All right. Well, that was simple. It didn't even really change anything. We were having a really nice pre-show. So a little bit of technicalities. We're hosting this on LinkedIn Live, so as people tune in, they'll be able to see it. It'll also be recorded, so people could watch it afterwards. And then we have a Telegram community that we will send it out to an email. So that's that. And then if people are listening on the show live as we speak, which is really cool, then if you message on the LinkedIn comment section, we'll take a look at your comment and add it to our conversation. So, Ramin, super excited to have you on. You are doing a lot of pioneering work at Healthvana. You're a longtime founder, having been at Healthvana for 7 years. Is it 8 years? About that? Yeah. Long time. Yeah. And yeah, what can you give just a quick highlight as to you guys started off building testing interfaces for HIV, and now you're doing COVID and you're doing other areas. But the company is foundationally built on user interfaces for receiving test results, which are not just test results as in your grades in school, but medical, really important test results. How's it been, man? How you been?
It's good to see you. Thank you for having me on. It's good. I think sometimes it's important to figure out where this all started. And for me, it was when I was taking care of my father a number of years ago, before he passed away from lung cancer. And the most frustrating thing was trying to help him figure out what was going on and if he was okay. So in healthcare, I think it all comes down to a couple of really simple things that we all experience. One is the only thing you care about, and that usually happens when you're waiting for test results from your doctor about something serious, is, am I going to be okay or not? That's global, right? Everyone has that same experience. And so we really help people understand if they're okay or not by delivering not only test results, but also in a way that's actionable. So it won't have this complicated PDF type stuff, but it'll actually tell you what to do next. So the genesis of it was really to help people figure out if they're okay or not, interact in their health in a way that they can use their phones. And we've said this for a long time, that the patient is the most underutilized and underappreciated resource in all of healthcare. We don't share information with them. We kind of feel like they shouldn't have it, or they can't believe it, or they can't figure out what to do. And I think that's nonsense. So empowering them is really helpful. So we've done that work in sexual health and HIV, like you mentioned, for a number of years. We jumped in that category for a number of reasons, but some of them that are most relevant today is HIV is the most sensitive protected health information in the United States under HIPAA. So if you can do it with HIV, you can certainly do it in other categories. And also, it's a community that's generally underserved. And unfortunately, a lot of the burden of HIV falls among those that are in communities of color. So disproportionately, if you are a Black man who has sex with other men in the United States today, your odds of acquiring HIV are about 1 in 2, right? So we've worked with these communities for a long time. When COVID came along, we were asked by municipalities, large counties, states, and others to help them deliver the test results information the same way we've done for HIV, to get people their information and also help them understand what they were supposed to do next. Is that a helpful background?
Yeah, totally. And at Healthvana as a company, just to frame the perimeter of this, so you are building a software interface for people to receive the test results, and then you're help me map this out. So you're integrating with the lab companies who are running these, like is it LabCorp or other smaller labs as well? And there's a API integration with them. Like from a technical perspective, what are the arms of Healthvana?
Yeah, of course. We are, if it's really simple to break it down, to CRM for healthcare providers. So we help them, we're a patient communication platform that is used by healthcare providers to manage and communicate with their patient populations. A lot of times this was considered a patient portal. We think those look like Windows 95, and we look and feel more like Instagram. And we have data that shows we deliver better outcomes by engaging patients in a way that they're used to seeing. So we'll do whatever it takes to get access to the information. It's not always as sophisticated as an API. Sometimes it's just a CSV dump into our Amazon S3 bucket that's all HIPAA compliant. And then we parse the information and get it out to people. Other times we're getting it through an EMR. A lot of times with COVID, we've gotten it through the labs. So we will, in some, I think it was in Florida, we were working with a municipality, a county, and they had 5 or 6 different labs, and they were asking us to integrate with each of those labs and then funnel them all into one patient user experience through Healthvana. And then we would also do all of the support in multiple languages. So for them, it was really helpful, not that we were delivering the information, not only that, but also that we were actually doing all the support when people inevitably said, hey, my name is Michael, not Mike, and you registered or you fat fingered the wrong phone number. So we've had probably 1 million of those we've answered in the last 18 months alone.
Damn. And COVID obviously was a huge impact in the business. So you're sitting there, you're focused on HIV, and you're very successful in this. HIV is a major problem. It's less so now than it was in the 90s. Is that right? I mean, generally we're declining US and then internationally HIV. Correct me. I'm largely just pulling this out of the ether.
It's pretty good. So the government spends about 30 billion a year on HIV overall, the US government. For every new HIV infection, the CDC estimates that costs our healthcare system over the patient's lifetime about $500,000. The drugs to either prevent HIV, and there's a pill you can take called PrEP that is a prophylactic that you can take to prevent HIV if you take it daily, similar to the way a woman would take birth control. Same levels of efficacy, incredible drugs out there. The drugs for that and the ones that you take if you're HIV positive are incredibly similar, and they also both cost around $20,000 a year. So it's a very expensive condition. And overall, the cases of HIV haven't really moved that much in the last 20 or 30 years. There's been great efforts to make sure they don't balloon above 40,000 a year, which is about the number we see right now of new cases of HIV. And they've dipped down to maybe 35,000, which is great. But under this current administration and the last one, there's this goal now to end HIV by 2030. And also to reduce HIV by about 75%, the new cases per year that is, before 2025. So that means going from about 40,000 cases down to 10,000 cases. And in our view, and I've said this with the Presidential Advisory Council on HIV/AIDS, which we work with, that this is not going to be possible unless you use technology to help people engage in their health. It's really hard to decrease those numbers in a meaningful way otherwise, in our view. Does that help give you an overview of HIV?
Yeah, totally.
We're the largest in the US for this kind of work.
And it feels like HIV is you don't know you have it when you have it. Unlike other illnesses, if you catch a cold, or you have the flu, even COVID, you have symptoms, and the symptoms are with HIV, there's no external symptoms right away, so spreading it's obviously conducted
generally
only through,
no. Yeah, and testing is so easy now that it can be within 1 minute with a finger prick or 20 minutes with a swab. And there's incredible drugs. So I just want to be really clear on this. If you're HIV positive and you take your medication as prescribed, like Magic Johnson would, for example, if you have sex without a condom, the odds of transmitting HIV to someone else is 0.
Whoa, really?
That's how good the drugs are. It's called U equals U, undetectable, meaning you don't have enough viral load in your system, equals untransmittable. You cannot. That's how incredible the drugs are. And that's why there really is this strong belief that we can end HIV as the way it's been for a long time within the next 10 years, and certainly make a huge movement towards that in the next 5. And a lot of the lessons we learned in HIV around how people don't trust the government, they don't trust medicine, it's called generally medical mistrust, has helped serve us really well in helping during COVID, and the same populations in underserved communities that we've really spent a lot of time working with.
What has helped?
Medical mistrust. So there's this broad sense of, you're hearing vaccination hesitancy.
Yeah.
You're hearing all sorts of different pieces of this. This is nothing new. There's plenty of reasons why communities of color, immigrants, all sorts of people generally have a mistrust of the medical system and doctors and or the government in combination with that. And so let me give you a stat. In 2016, there was a study done across the United States of African Americans around HIV. And they found that 40% surveyed said they believed the government had a cure for HIV, but did not want to give it to the poor. So you have lots of medical mistrust out there around COVID. We knew this was something that was going to come up. I've written about this a little bit as well, just to share what we've learned in our work with HIV. So there's a lot of hurdles that you have to kind of get over in order to get people to trust it. And again, the communities that believe this are absolutely valid in their concerns. They understand from historical references of things like Tuskegee, there's some background on things like that, why people don't trust the government and or medical people. And in order to understand, let's say, vaccination hesitancy, and that's broken down into multiple fragments, it's not just one monolithic group. I think it's incredibly important to understand and understand that it's real. The medical mistrust is a real thing out there before you move on.
Yeah. And it's a real thing because of the way that the people who have held positions of power have acted in the past. So they've broken that trust in the past and effectively are paying the repercussions of it today. Is that
correct? Yeah, the
yeah?
Tuskegee Experiment, in short, was a lot of African Americans were given syphilis essentially and left untreated,
Mhm.
but monitored to see how syphilis impacted their lives. It's disgusting. It's these things,
Yeah,
and that went on for a very long time. And I think under President Clinton, he apologized publicly for what the government did on that.
yeah.
And so there's a lot of learnings, but those lessons get passed on among generations. And so a lot of hesitancy and that stuff is there, at least domestically, that we know about because of medical mistrust.
And I think, correct me if I'm wrong, or if you see it differently, but certainly there's a race divide. But I think it goes much bigger than that because there's a divide based on if you're in a city or a more rural area, which makes sense. There's a divide based on education. Certainly, the political divide, if you're left or right, plays a big role in that. But I don't think it's like a race issue. I mean, there's certainly discrepancy. There will be a discrepancy on everything if you break it down by race, but it seems to not be a fundamentally race-based issue. It's more of a distrust in the structure of the incentive system of the pharma companies. I mean, do you see it that way as well?
I think it's multi-level. I can speak on it on behalf of what we've seen on HIV and some of the work we've done in COVID, but there's a lot of smart people talking about this. But the biggest idea is, can you get people to take shots? And will mandates move people? Will they not move people? And then politics has played a role in this, like I think it generally always does. And so it's a challenge. There's no doubt.
Yeah.
And our role is, not to talk about the politics or to get involved in the politics or make our viewpoints on the politics. I mean, our view is very clear, and it has been for years, and that's to empower people, patients, with their information, again, their information at their fingertips in a way they understand as soon as humanly possible. And so, for example, we've delivered over 10 million COVID-19 test results since April of 2020. And we're one of the largest in the US at doing this. And what we're really proud of is that 97% of people view those test results on Healthvana within the first day. And even more impressive for we're really proud of this, is on average, people view them in the first 15 minutes, Mike. So we get it from the lab, however we get it. As soon as we get it, we instantly send it out 24/7. And then people can view their test results. And it's so simple. They get a text or an email. They click on the link. They enter their first name, last name, date of birth. And within 10 or 15 seconds, they can see their result. And if they're positive,
do they share it? It's like an Instagram where you can share it and like other people's test results. And no, I'm just kidding.
Interesting. Well, so you can certainly screenshot it and share it, which a lot of people have done. We see a ton of people share it on social media, whether they're positive or negative. But what we've added to it is this piece for some of the communities we work with. If you're positive for COVID-19, just below it, it will say something like "Help save lives," anonymously contact anonymously notify others, close contacts, and they'll get free testing options. And it's worked remarkably well because just below it, it's really low tech, right? Because we're not talking about an app. We're talking about mobile web, or if you get this as an email, it can be on your desktop or anything that's internet enabled at home. And then you just put someone's information in, cell phone or email. And again, we're not pulling up your contact list or anything like that. And then someone else anonymously gets the notification. What's amazing is that what we found was the people, in comparison to the municipalities, one of the municipalities we did this, people were twice as likely to gave twice as many names versus just when someone gave them a phone call, right? And then also 3/4 of the people that were using the feature that I just described were from communities of color, which from the data shows a lot of those communities aren't the ones to answer their phones to give names of other people. So the anonymity of it and the simplicity of it, I think, has really made a big difference.
Yeah. I mean, I think just giving names of people when they call you up. I mean, how many phone calls I get now? If I get a phone call from a number that's not my phone, it's like a 98% chance that it's someone selling me. It's either the IRS calling from India to tell me that I've been hacked, or a random Craigslist post, or like it's phone numbers in many ways I feel are kind of obsolete.
Antiquated,
right?
Yeah.
Doesn't it feel like that? Yeah. It's kind of last remaining.
We've been pushing text messaging. We've been pushing emails, empowering people to do essentially self-service. And when you do it and it's easy, and genuinely most of healthcare, and you know this, looks and feels like Windows 95, even though we're in the 21st century, well into it. And so you can't expect people to genuinely engage in their health if they can't even use it. I tried to use my mom's patient portal the other day because I help her out with her healthcare related stuff. I couldn't log in, right? I'm an
Oh
expert at
man.
this. So I had to call the 1-800 number. Literally, I had to
Yeah.
call a phone number. They said, no problem. We'll send you over the information. It's going to be mailed to your mom within 3 to 7
Yeah.
business days. And I'm
Yeah.
like,
That's
what world are
fantastic.
we in where you
Yeah.
can't access your own information?
And then you put the CD that we're going to send you, or the 8-track into your oh man, as I sit here and I'm like, I don't even know what I would do with that. Yeah, boy, that's so antiquated. I think it comes down to incentives like everything else. There just isn't the incentive to progress. I mean, my general view on like healthcare from the 50,000-foot level is that if there's not an incentive to make it a smooth experience, it won't be one. And so there's no surprise there. And I think I wish, I mean, just throwing this out in the ether of the world, that we politically, people could get together with saying the employers being involved in healthcare is like the splinter in the system. That the fact that we jam healthcare insurance through employers who they don't want to be involved in healthcare insurance, they're like, I just want to hire people and pay them, and the fact that people can choose their insurance to their employers and they can't get it on a public market if you're working, it keeps people locked in companies. It slows down entrepreneurship. It keeps people entrenched in the areas where they're scared to make changes because they lose healthcare through their employer. And it's like, it doesn't have to be that way. And I think if it wasn't, then there would be more. There's already some pretty cool Oscar Health and some other health insurance companies that are on the free market, but it'd be more innovative. You know, you'd have different options, and it seems like it would move the ball forward a lot. And I don't know. I don't know enough about it to know what the resistance is to that. Maybe just entrenched companies, but yeah.
Yeah, I mean, it is entrenched companies. I
Yeah.
remember I had a chance to present our work at the White House in 2016, and I was really bullish on what the Obama administration was doing. There was the High Tech
Mm.
Act, which was supposed to take us from paper to digital, which worked in a lot of ways, and there was other repercussions that weren't anticipated, or maybe not completely anticipated. Then we had the Trump administration, which was really about pricing transparency and helping patients get access to information. So there's some moves there. Now the Biden administration is also pushing on patient access. And also health equity, making sure we're helping the right people. What I've learned is that unless you can move the entrenched interest, it's not going to move. And it's just really challenging. I don't know how
Yeah.
else to really describe it. So what we've really focused on is,
Mm.
are there use cases where we can show a glimpse of what, let's say, 21st century public health can look like? When the work we're doing with, let's say, LA County, the people there are incredibly innovative and thoughtful, and they move fast, and they have a partner in us that can actually move fast as well. Right.
Mm.
So, for example, when so we're delivering digital vaccination records right now in Los Angeles County. We've delivered millions of them, so people can actually get access to those digital vaccination records from whatever their vaccination was in the county. Then they can put them in their Apple Wallet, or they can put them in their Google Pay. So we were the first to do it in the world with Apple Wallet, or at least the US, in December of 2020. And we just announced some work we did with Google as a collaboration maybe a month ago about putting in the Google Pay, the idea of easy access to your information. So we're delivering these results. A byproduct of that means we can see who's gotten the J&J shot, right?
Oh God, you're in such a murky water. I mean, I feel for you. You must run into so much, right? Isn't there a lot of like political
We're
debate over right where
invigorated.
you lie?
Well, I got to tell you, we're invigorated by the people we work with in public health. These folks are incredible. They are hardworking. They are smart. And they're now being enabled to use technology in a way that is illustrated in this J&J example, where there was a pause for J&J a couple months ago, right?
Yeah.
What we were able to do with the county in short order was on their behalf, because all this is on their behalf. We're the pipes. We're delivering the information, right?
Yeah.
We were able to message every single person who had gotten a J&J shot in LA within about a day and a half of the announcement coming out, to let them know what they should know. Think about that kind of targeted healthcare. Any
That's
other part of
awesome.
technology would be like, of course, why else wouldn't you do that? It's like, right? In this
Yeah.
case, with public health, you're doing that. 90% of people viewed the message within the first few hours. And all we got back were thousands of thank yous that were meant for, obviously, that county.
Yeah.
And so we're able to do that with boosters. We'll be able to do the same, where we'll notify whatever population is available to get a booster. You can make that notification. And there's a lot of important pieces, I think, where you can utilize just the most basic parts of technology if you're a part of the workflow and you have systems that don't look like Windows 95. I should have worn a Windows 95 shirt today. I have one.
I'll get one. I'll make one and send it to you.
I got one.
Oh, do you? That's great.
I do. I've worn it on interviews before. It's a little jarring, I think, for people.
That's pretty funny. We could take it. Man, I feel for you though. You really are, like you said, building the pipes, and also you're in the middle of a war zone, so to speak, right? There's a lot of varying opinions between the centralization of power by the government and the slippery slope of whether the government should have data and access and power to control what people do or don't do. And then on the other side, it's safety. We don't want people in society to die unnecessarily, obviously. So they meet, and it feels like where they meet is right where you're hanging out. And you're like, well, we're going to build these pipes. Do you have internal decisions on products that are difficult? I mean, you have to, there's certainly some things you could build that you decide not to build. And then you have to have conversations through that. Do you have a philosophy on deciding what to build and when to build it and how to think through that? Or is it just conversations? I'm curious what happens behind the scenes. Some
process, a lot of conversations. Everything's been pretty light speed, I guess is a good way of describing it.
Yeah.
And the only way we're able to do this, I mean, I'm talking to you about this, but it's the people in our team that are incredible, that actually care about helping patients, that we've been doing this work for years. The HIV was a test of what we could do when it came to COVID, right? Not knowing, because sharing your HIV results is something we would advocate for people doing dating sites, if you remember years ago.
Yeah,
and that was the idea.
That's still going on. Do people still have it?
Absolutely. And isn't that exact same use case the same thing with COVID, where people are sharing their vaccination records? If you go to Healthvana's Twitter account and you look at our replies, you'll see hundreds, thousands of people that are sharing their vaccination records, talking about them like in their Apple Wallet or their Google Pay. So all the credit goes certainly to our team for being able to work through these on a process standpoint, on a technology standpoint, what we can build. But I think it's probably helpful to come up with we've kind of had two things that have been really helpful for us to think about. One is when things were really bad with COVID, and I know they're bad again, but before we had a vaccination, our kind of internal thing that we kept saying was speed is life. Whatever we can do to get information to people faster will help them make better decisions on their health. We've always kind of been about empowering patients with their information at their fingertips. We know that will move the needle. However, with COVID, it was speed is life, because a lot of lab delays were causing people not to get them for days on end. They couldn't log into their portals. They didn't speak English, right? It was Spanish first. And so everything we did was very much with an eye towards helping save lives. So speed is life. When after the surge of maybe that ended around January, we kind of shifted into helping more people and faster. So what that meant was, are there partnerships, are there ways for us to collaborate with groups that are working with millions, tens of millions of people in a way that we could really help? Google Pay was one of those. We made an announcement with a multi-billion-dollar lab that was doing great work and getting information out to people, including the variant for which you test positive for. Right? So knowing which variant you have could be helpful in the future if you experience long COVID. No one's really talking about that, right? So those are the kinds of things that have guided us. But overarching, it's always been, how do we help people? How do we help people live healthier? And it sounds really generic, but all of us have been espousing the same things for years. They're just more in vogue than they've ever been.
Yeah, no, that's super interesting. And so you're spending your time doing podcasts, thinking about the vision of the future. Where are you spending your time? Is it more on product and internal ops, or more on external communications and BD with institutions to set up partnerships and that sort of thing?
Primarily on internal and the work in BD, less so on the media front. I mean, we've been very fortunate to be covered by the New York Times, Fox, NPR, a bunch of the national outlets, but we're really focused on the work. The most important thing is helping people as fast as we can. And where can we help these people? What states are struggling? What are we able to help with in those states? How do you help broadly utilize COVID in a positive way, which is really hard to say, but in a positive way, to where patients now have access to information here in their Apple Wallet? Like, do they want other immunization information there? So we're working with states and talking to health information exchanges, which already have all the data for patients in those states, that are shared between healthcare providers broadly and health systems and plans, insurance companies. So that data is already there in these health information exchanges. The crazy thing is they're not available to patients in most cases. It may be available in what we call pull, which is you go to some portal, you enter some information, and then you may be able to pull your information out if everything matches. If not, you'll try to correct it. We like the push methodology, which is proactively giving it to people, saying, if you want it, here it is. Absolutely your choice if you ever want this, right? Or if you choose to ever share it with anyone, which again is the exact same thing we've done with HIV and sexual health for a number of years. It's your information. HIPAA makes sure that you have a right to a copy of it, and you have a right to a corrected copy of it. So we think still, by focusing on the patient to get them the information, everything downstream will work better. But the future of healthcare for us is generally getting patients involved, but then also marching towards a concept called digital therapeutics, which I don't know if you want me to talk about or not.
Well, you piqued my interest now. I want to know what digital therapeutics is.
Yeah. So I would so digital therapeutics at its most basic is a therapeutic, like a drug, but in a digital form. So there are two types of digital therapeutics broadly. One is in replacement of a drug. So for places where drugs don't have great efficacy and may have a lot of side effects, let's take, for example, maybe this is not a great one, but PTSD. Maybe there's not great drugs for that. I don't know definitively, but maybe there's cognitive behavioral therapy and tools that you can now use on your phone or through an app or through a game that will give you the same outcomes a month, 2 months, 6 months later than a drug might have. But you're not taking a drug, right? So
what do
there's
you think about that? Is that what's going on there?
The entire future is going that way. And then there's a secondary. I'll tell you kind of where it is currently. It's early, and it's I think digital therapeutics are. They have to be approved by the FDA as well. This isn't something that's brand new. That's like just a concept, right? The FDA already has approval processes for those. Where Healthvana fits in, and we've been kind of marching towards for years, is a companion digital therapeutic. What that means is you take a drug, let's say HIV medication, and you combine it with technology or an app like Healthvana or some sort of software. And if that can help lead to better outcomes, meaning better adherence, better persistence, right, lower, that's a huge benefit if you can help people stay on medication longer, if that's something they want to do. And in the case of HIV, like I mentioned earlier, it's incredibly important if you're HIV positive to stay on top of your medication. And then there's a drug now that you can take that will prevent you from getting HIV if you take it consistently. So we're going to be doing some really cool announcements by the end of the year on our work around digital therapeutics. We don't usually call them that because I think it's still a pretty new term. But where they are is really early. There's companies that have raised hundreds of millions of dollars around this. But much like telemedicine, there isn't a reimbursement model that quite makes sense yet. And because of that, they haven't been widely adopted. But in the near future, I don't know if that's 5 years, 10 years, but in the future, you will absolutely be prescribed by a physician a therapeutic, a digital therapeutic that goes along with your medication, right? You can imagine, again, wearables and how that'll all play in. But that's my view, our view as a company of where we think most of healthcare is going. And you can't get there unless you do the basic stuff, which is number one, get a patient's attention, which we're really good at doing. And then number two, can you get them to take an action? And we're good at that too. So we have a lot of data and evidence we've been producing since 2015 to show that we can actually do that.
Wow. Yeah, that's super interesting. The idea of prescribing a digital drug, a digital therapeutic, and I mean, you could see it. People will refer to Instagram as being addictive, and the reference to it, like treating it like a drug. And it's a fine line, right? Because what does drugs do for us? Many of them alter our psychological experience. You know, certainly SSRIs are more of the psychological problems you have. Pain is a big one, and it's not different from other things. I mean, I think digital is interesting. Why? Because it can be specifically designed to have some reaction in people that is useful. Like people are far less likely to take their own prescriptions than they are to give a prescription to their dog. Have you heard that stat before? Which it's very true. It's like if you're given like, hey, give your dog this medication, people are going to do it way more often than they would take it themselves. And so you could have, I'm sure you're thinking about like push notifications, reminders, engagement. There's a company that I think Omada is the what I'm thinking of that is kind of specifically around this adherence to prescriptions. And it's interesting. I don't know. I mean, do you feel that that's right? That should be covered, that should be paid for? I guess so, right? Paid for by health insurance companies?
Short answer is yes. And it comes with a longer answer of supported by clinical research, evidence, peer-reviewed published studies, showing that this actually has efficacy is incredibly important, and that takes time in healthcare, and rightfully so. probably a little longer than it should in my view, but I'm not a clinician.
Yeah.
So I think it's really important, and you're going to see a lot of digital therapeutics. There are already a lot out there. There's people that know far more about this. There's conferences on it. The reimbursement model, much like telemedicine, no one was really using telemedicine until it was all of a sudden reimbursed because of the pandemic. And can you imagine us not using telemedicine? It'll be the exact same thing with digital therapeutics. Again, it's optional, just like taking a drug will be. And can it help? And of course, it can monitor you. Like if you have watches that can tell your heart rate when you take a pill, does that change what's happening in your body physiologically? There's a lot of interesting things that start to come about that you can use, again, if you choose to use them.
I laughed because you reminded me of this story. Because one of my close friends is a strength coach in the NBA, and so he coaches basketball players, and they're highly incentivized to score points and perform well on the court. And they look at all these different techniques to help them: cryo chambers, like a $90,000 cryo chamber, all this new expensive equipment, dietary supplements, all these things. And he's coaching them, and he's like, some days these guys are just down. They're just tired. They haven't seen their family. They're down emotionally. And there's nothing we can buy for them that's going to help them. And he's like, what they really need is a puppy. He's like, I swear, if you were to give this guy a puppy, he would be boosted up. He'd have more energy. And it's like, it's thinking about it, obviously almost apples to oranges, but instead of popping a pill to get energy, it's looking at other ways. It's really isn't it like looking at the human being initially as a machine? That's the initial construct of what the human was, probably in the 18th century when we first come about these drugs and ways of interacting. And you have this mindset of we're gonna tune it up. Take this pill for this, take this pill for this. You're gonna come in there and tweak this and fix that. But now it's kind of this awakening into humans are much more. We're spiritual beings. We're psychological beings. Relationships are super important. How we relate and feel about our own purpose in the world play just as much of a role in our lives as anything else, and mental health. And you can kind of see that in some patterns I find interesting, like the legalization and research on psychedelics is one clue. Depression being so prevalent is another one, where it's like it seems directionally that's where the opportunities to help people in healthcare are, among others, I'm sure. But
I hope so. It's absolutely whatever we can use to help. We're connected in different ways than we've ever been before, obviously, because of the internet over the last however many decades now. But what I will say is an interesting data point to know is we spend, $3+ trillion a year on healthcare in the US, right? Mm-hmm. And we don't get great care for it, relatively speaking. Is what a lot of people would say. 70% of that 3 trillion is because of 10% of our population. So of our 330 million people, whatever that number is, I think, of our population, 10% account for 70% of all healthcare spend. And in that 10%, you will find a bunch of different areas, but big buckets include chronic conditions. People have multiple chronic conditions. And you'll also find generally underserved communities, especially in communities of color. And you can see a lot of this, unfortunately, in the South, where you have the combination of broadly medical mistrust, unhealthier populations for different reasons. And then also you have lower vaccination rates, which is why some people are saying the South is getting hit with COVID harder than other areas that might have higher vaccination rates. But there's a lot of pieces that go into it. But I think it's important from a healthcare standpoint, you have to always follow the money. You can be as altruistic as you want, but you have to understand where the money flows. And digital therapeutics won't really go there until there's a reimbursement model that's endorsed by everyone. Got to be prescribed by doctors, got to be bought in by health systems. The plans and the payers have to pay for it. Pharma is going to get on board. They're looking at a lot of digital therapeutics already. There's benefits for them as well to be ahead of this. So there's a lot coming, but it's positive, I think, overall, because you're able to kind of help yourself, hopefully, more so by using things like Calm or Headspace when you talk about mental health. These are all directionally good, I think.
Well, why do you think people are so, it seems if you're going to boil down the problem, the reason why our country is as unhealthy as it is it seems to me that it boils down to eating habits, and that being obese, if you're going to take one indicator, being obese, being very overweight is going to lead to everything else. Like you're going to lead to hip replacements because your body's so heavy, diabetes, all sorts of, your body's under stress all the time. And that's certainly a function of the way that we produce food in large part, for sure, the way that we market food.
Food deserts as well, where you
Food
don't have
deserts,
fresh
yeah.
food near you, where it's much
Yeah.
cheaper. It's also socioeconomic.
Yeah. Yeah.
Right? If you
Yeah.
can't, if McDonald's is the cheapest option for your
Yeah.
entire family, and you don't have a supermarket
Yeah.
within a certain amount of areas of you, or understanding how that is and where that is priority, I can speak on this at the most tiny surface level, but broadly, yes. And I think the importance of understanding where we spend our money in healthcare and where the people could use our help the most are where companies like Omada is one. I think there's a number of companies focused on how to help these populations. And certainly the insurance companies want to help them because they're the ones who cost them the most amount of money. There's all sorts of reasons where you want to figure out where the Venn diagram overlaps, where you can make an impact to help people, but it also financially makes sense in a lot of different ways.
Yeah. I have this idea that I've been thinking about a lot lately, which is, how the people talk about, what's the politician? Andrew Chen was his name.
The man for mayor of New York.
Yeah. And he ran for president before that.
Yeah.
But he talks a lot. He's a smart guy. I like him a lot, but he talks about, the jobs being taken over by technology. The technology will displace jobs. And that's certainly true. And that has been historically true and will continue to be true. But then new opportunities will be created through that new technology. Like you can be a VR graphic designer, and that's not even a job yet, for instance. And I think one challenge is the truck drivers. There's millions of people who drive trucks, and when trucks go automated, what do you do? And that's a topic that gets thrown around. And I look at the food crisis, like you said, the food deserts, the fact that we're producing these unhealthy options for people. And I think that throwing this out there again in the world, I think that there's an opportunity to create these local, diversified farms where people are willing to pay a little bit more for the food, but the food has strawberries next to potatoes, next to a pig, the farm has maybe 25 employees, and they all produce this food, they sell it locally, and that can be reproduced. You can just take that same model where you're like, okay, you got to spend, just like you're going to open up, say you want to open up a franchise, McDonald's franchise, it's going to cost you $125,000 down, and you get 70% ownership. McDonald's owns the rest. They own the building. That's roughly how they structure franchises. I think the future will be, you want to open up a farm franchise, you employ people, you pay a down payment for the equipment, you split it, you can finance it if you want, but you can be a producer of food locally and employ people and feed your community. People get healthier. The percentage of capital that gets spent on percentage GDP spent on healthcare decreases. Per capita increases on food, but you're living a better life. And I'm pretty bullish on that. I would love to see that happen. There's this great video called The Biggest Little Farm. It's a documentary that kind of inspired this concept. And yeah,
I'd love it. I would start it. It'd be great. If people aren't doing more. I mean, as you know, you've started companies. It's always difficult, and you've started companies in different industries. I've never encountered an industry more difficult than healthcare.
Yeah,
it's not clear where the money goes. Pharma is very clear. They want to sell drugs, and that's not a bad thing. Drugs can help people, right? And anything really powerful is going to have good and bad things about it. Even the way Facebook was initially amazing, but now people don't like it as much. It just depends. Anything that's powerful is going to have both sides. But I think scaling these things is difficult. There's a lot of different people, and who's going to fund it. Like, it's all those things that are pretty exciting. If people can figure out what these look like, there's a lot of great solutions that I've seen. Like one of my favorite ones was where they put mini farmers markets, essentially fresh produce, at bus stops.
Oh, that's genius. Yeah.
I think low-tech solutions a lot of times are the best. We've really thought that, especially during COVID, about not over-engineering solutions that are Bluetooth enabled, contact tracing that you have to opt into, and then when you get your results, you have to call the state. The state has to give you a PIN code. I get how it all makes sense logically, but in practice, that's a lot of steps, and especially if they don't have your records yet. So that's why we were like, okay, you're positive, put someone's name in. Just put one name in, maybe two. Screenshot, share it with someone. it's the immediacy and the, I think, lower tech solutions that a lot of times will move the needle further. And that's what we've been really thinking about for a number of years, is where can we really help without getting crazy fancy? And it's
Yeah.
hard. And a lot of it
Yeah.
is just, can you make it simple for people to engage? And this is also with food, right? It's really hard. They're all incredibly hard problems. And again, I can speak superficially for a
Hmm.
little bit of it, but my goodness, anyone who wants to jump in and help with these things, please do. We need more
Yeah.
people trying to figure out these problems and setting up pilots that might last a month or 5 years to see if they work. And then you never know when one of those can actually help with something we didn't anticipate, like us in HIV and COVID. We
Hmm.
never, ever would have thought that there was a use case where people would want to share their information in this way.
Mm. How about internationally? You thinking about other countries now? Are you in other countries, or what would
We're
be the
not,
progress of
and we've
other
spoken
countries?
to a number of countries. We would love to help more,
Mm.
and more places. It's challenging for all
Yeah.
sorts of reasons. And so there may be a country, a pretty big one that we work with here in the next couple of months, but that
Mm.
takes a lot of work to figure out where you're set up, what's happening, and there's a lot there. So what we
Hmm.
focused on is the US, where we do
Hmm.
really well. And a lot of what we've done during COVID is say no to a lot of projects. We wish we could
Yeah.
work with
Smart.
everyone, but we have a certain size team. We know what we're pretty good at doing, and there's a lot of things we're good at, but we know what we're really good at doing and what scales and
Mm.
what can help the most people the fastest. So we've really been thoughtful, and again, we have an extraordinary group of people that genuinely care about
Mm.
helping others and that have spent days and nights working on this since the pandemic began, almost nonstop for a long time. And so we really want to think about where we can make the biggest impact and where our solutions can scale broadly and quickly that genuinely help people. Less about
Mm.
other parts of the healthcare system, but how can we help people as fast as possible?
Hmm. Have you ever thought about open sourcing the code that you guys have built? Maybe that one idea would be open source it and then allow other people in other countries to kind of pull it down and retrofit to their. Does that make sense? I mean, is that even feasible?
It's difficult because it's not always as easy as that. What we
Yeah.
have done though is we have plenty of presentations where we show exactly the decks we present to everyone. We show
Yeah.
exactly how we've done it, how we've thought about it. What we know is the pieces all look different depending on where you are. It
Yeah.
can be even as complicated as, well, how do you integrate with a lab? Well, we can get a CSV file, we can get some sort of HL7 feed, we can get, there's a lot of ways of doing it, but at the end of the day, they just want to do what's fastest and easiest because
Hmm.
that's going to help people. And everyone in public health is slammed. I mean, these folks also
Hmm.
who work so hard haven't slept for a good part
Hmm.
of a year and a half. And the
Hmm.
incredible frontline healthcare workers that are doing a lot of this work, and the people that are at grocery stores, right, are exposing themselves, that are generally in
Hmm.
communities that are most affected by COVID. There's just a lot of different pieces to this. But what we found is just by sharing what we're doing publicly, and anyone who asks us, we're just like, hey, if you want to copy this, copy it.
Yeah.
Right? Like,
Yeah.
this
That's
isn't
awesome.
brain surgery. This is attached to a positive test result and ability for someone to enter additional information. Then you send that information off instantly
Yeah.
to someone else to notify them. And we know it works really well. And even if it doesn't work really well, you're getting a portion of people information in real time. And that's what's going to help save lives and help impact people the broadest way.
Yeah. Super interesting, man. I commend you guys on all the progress. Um, yeah. I find it so interesting to think about where the honest debate is, where I almost, I not almost, I wish we could have more uh, honest debates about where the tip of the spear is. Like there's some point at this point, I feel I honestly don't understand it. The vaccine, there's a lot of, how to say this. There's a lot of parts about the vaccine debate that you could segment out and say, I feel very confident about this. There's others you could say, I feel less confident. And then there's some that are in the kind of experimental, debating phase. And it's unfortunate. And I don't know how this changes or improves, but it seems like everything initially, like knee jerk, would be politically divided. It's almost, it doesn't even, the truth is kind of like a, tier two. It's like, okay, well, where does this line up on our political divides? And it feels super unhealthy. I mean, it feels like if we can't have honest debate, like the whole point of conservative and progressive is that one people want to stay, one group wants to change, and then we debate that and we talk to each other. And it's like the gears aren't connecting. It's, you know what I mean? Like they're not, engaging with each other. They're just talking. And then they're like, they care about different things that are both very important and relevant, but it's missing. And I don't know if you have any thought on that from a healthcare perspective, because the healthcare is where the conversation is today. It's around these sorts of things.
Broadly, no.
Yeah.
Healthcare specific, our focus is going to be just on making sure patients get the information. I was on, I think, Fox the other day, which most people would call conservative. And I was talking about a topic that I think will be relevant, vaccination records, and how some people call them vaccine passports. And we've been set against the term vaccine passport since December. On Fox, when I was on there, the point I use is, look, you have access to your cholesterol information, right? Great.
Yeah.
You have a legal right to that. And then if you want to share it with someone else, your doctor, if you want to post it on Facebook, you want to post it anywhere, that's up to you. That's your freedom to choose whatever you want to do. But first and foremost, the first order problem is you should have access to that information in a way you understand. And so we don't like the term passport, and we've been really clear about this. And it's changing because of the way because of Delta now more, where there's mandates in certain cities and there's more to come.
Why do you not like it? Or does the word imply like,
Well, yeah. So a passport is a federal document that enables you to travel overseas, correct? Or it restricts you from traveling overseas without it. And there's kind of a process to go through it, and it's from the US government. A vaccine passport doesn't make sense because you're not going to want to restrict people from moving. It's domestic, first of all. It's not issued by the federal government. There are hundreds of thousands of vaccination providers doing amazing work to get shots in arms to people who want them, right? They're reporting that data up, and all of that data goes into, I think it's 64 different immunization registries across the country that have all vaccination information, or as much of it as it can. But one of the problems Mike runs into, the data is not great. You could be Michael, you could be Mike on one, because remember the registration systems were different from when you're registering for vaccination. That data goes upstream, or if someone's capturing your handwritten information, they may mistype it. So most of the errors we get from the emails from people are like, hey, my name is misspelled. I can't access my record because my last name is O'Connor, and the apostrophe doesn't work because it didn't work in the registration system. It really is a data problem, right? It's not us discriminating against Irish people. It's like this insane thing. So my point is, there's lots of vaccination providers across the country, all different data bubbling up versus one centralized federal government passport. And the term just doesn't make much sense. And you already have a political divide around it. What it is before a passport is your medical record that is protected by HIPAA. You have a right to it, and you have a right to correct information on it. And then you have a right to choose it with whoever, choose to share it however you want. If your employer mandates it and you don't want to work there, or you don't want to get the vaccination, whatever it is, or you don't want to do the weekly testing, you choose to go somewhere else. It's not always that simple. But I've been saying for a long time, I don't anticipate that you'll be asked for this vaccination record very often. But you have it if you want it. And if you lose your card, here's a copy. And also when there's boosters, you'll know when you got your shot and which one you got. Right? I mean, it's just good to have this information at your fingertips. With Delta, things have changed where it's more transmissible. There's real issues where people who actually have the vaccination can transmit it to others, even when asymptomatic. Although rare, that's something that's changed the game completely. So more people are now showing their vaccination records in Los Angeles, for example, when they go into bars. Then it comes up to whether or not you can be scanned through the QR code. We have a QR code on Healthvana that we developed in December because we didn't know if the federal government would mandate some sort of one registry, right? It wasn't known at that time. So our QR code goes to Healthvana and just tells you who Healthvana is, who we partner with, which are healthcare providers, public health agencies. So it's not like you're self-reporting the information. It's coming directly from some sort of data repository that's from your healthcare provider. There are other vaccination records that have a QR code that also verifies who you are. New York instituted this. We haven't liked that very much to date, meaning up until Delta, because it didn't make sense because no one's scanning you, because that's, again, it seems over-engineered. There's more building around the idea of scanning someone in, although we're not seeing it happen very often. International flights, we can certainly see that taking place, but less so to be scanned to go into a grocery store or a bar. We know bars that are asking for it. People just kind of flash Healthvana and then they walk on. Will this be a thing for a long time? Not sure. for us,
Yeah.
we continue to lean into one thing, which is we want patients to have access to it and they can make a decision on what they want to do with it. We could obviously
Yeah.
modify the QR code and issue a new set of them for people who want them that can be scanned in a way that, you know, is relying on this thing called the smart health card technology. That there's multiple technologies people are looking to use as the QR code in the back end of this that is open source. That's one of them that seems to have won out. The state of California is using that. I think the state of New York is moving over to that. I think Walmart's using that particular technology. But there's also, you know, a number of states that have said no vaccine passports. So you have
So
a
interesting.
lot of fragmentation. So that goes into your political conversation. And I
Yeah.
think vaccination records is one of them. But I don't think you'll find anyone arguing with us, including the person on Fox News, which was like, you have a right to your health information, right? Let's start there. Everything
Yeah.
that comes after that is up to you or up to how your city, your county, your state, your employer ends up determining how they want to do this. But we've always said we think it's going to be either a test of COVID, a vaccination record, and or in some cases, if you've previously had COVID, to be able to show that you had it, right? That might be through some sort of antibody test in the future or just showing that you've had it. And this is me looking globally at what's being accepted in countries like France that have instituted this kind of very strict version of showing your information. But it also puts a large burden on businesses to scan
Yeah.
you when you come in, or at least scan what you're showing them. So it'll be, who knows how it'll play out, but we know that people are thinking about this that are much smarter than us. And we just want to make sure we get the information in people's hands so they have it like all of their other health information. Was that helpful or interesting based on the political
Yeah,
part you're
dude,
talking about?
I love whenever you go on a rip like that. I love listening to it. You have such a unique perspective. I think sometimes you don't give yourself enough credit. I mean, you're doing so much. You're in such a unique position. You know, you really are running this company at a time like this. I'm sure some nights you must just kick back and be like, God, I can't believe I'm doing this.
I can tell you that we're invigorated by being able to help people. So if the goal of the
Yeah.
company, the true North Star has been, and you've known me for years, has been to genuinely help people get access to their information and use it how they choose. We think that empowerment is the incentive you were talking about earlier.
Yeah.
The incentive is I want to know if I'm okay or not. So I'm going to really key in on my lab result because that's going to tell me. Right. So we play off of that as the tip of the spear. And then if that's easy, great. Well, we can remind you when your next appointment is, or we can remind you to take your medication, or, hey, did you know it's flu season and people who get a flu shot in your, county are much less likely to get the flu. Do you know what I mean? Like very simple nudges that make sense as a part of your normal healthcare, not giving you 60 options of what to do on a patient portal where you're just like, I don't know what's happening. Right. We think this is a new version of how you can engage people. And we've called it patient engagement. But that's kind of lost its meaning because we don't know what that means necessarily anymore. At its core, we just want to help people make better decisions in their health, and we'll partner with people to do that. But our team is the one that's been able to build these things, and we stand on the, genuinely on the shoulders of the people that have been helping us do this and our partners for years. Because without actually having the partners to deploy these, we're just espousing ideas that we think are great without anyone using it. I can tell you now that we've delivered over 20 million COVID records in the last 18 months. That's a lot. And we work with, the New York City School District in helping deliver test results through a lab partner. We work in Florida, we work in Texas, Wisconsin, California. So there's no political edge, but I shared different sides of the political aisle, right? Because everyone wants access to their health information to protect them and their families.
Yeah. One thing I learned from you do a great job of is you keep it simple. You really don't get caught up in you could go down infinite rabbit holes of, especially nowadays with so much that we don't know and so many theories and like half-baked data sets and things. And you come back to the North Star. Well, we're just trying to send people give access to their data. And I think it's a testament to what has allowed you guys to make so much progress in such a short period of time.
Thanks for that. I think so too. And I think it started from just genuinely everyone around our team believes the same thing.
Yeah.
Everyone's, rowing the same direction, and it's easy to get behind because all of us go through this in our own lives.
Yeah.
Right.
Yeah.
Or as caregivers, and you want to know if your loved one or you're okay.
Yeah.
80% of decisions from your medical professionals are made based off of what? Labs.
Yeah. Wow. I don't think I quite realized that.
So start there, right?
Yeah.
Start by delivering the information that you said. Incentive. It's incredibly important to have incentive. Incentive also in the HIV world to have sex and maybe show someone else that you've been tested recently. or that you're HIV positive, but your viral load is undetectable, or that you're taking PrEP, a pill that can prevent you from getting HIV. So it's just, where do you align with what people already want to do, and how can you help just nudge a little bit to make better decisions?
Well, Ramin, thank you so much for joining. We've hit our hour mark and a little extra, so I appreciate your time here today. And again, congrats, man. And I look forward to talking to you soon.
Likewise, always good to see you. Thanks, Mike.
All right, bye. Cool.